higher risk for infections due to immunosuppressive therapy, which weakens their immune system. The infections can be classified into three main categories based on the time since transplantation and the type of pathogen. 1. Early post-transplant infections, 0 to 1 month. These are typically related to the surgery or hospital environment and include bacterial infections, surgical site infections, catheter-related bloodstream infections, urinary tract infections, UTIs, pneumonia, fungal infections, candida species, especially in mucocutaneous areas or bloodstream, viral infections, rare but may include reactivation of latent viruses such as herpes simplex virus, HSV, intermediate post-transplant infections, 1 to 6 months. These are often related to immunosuppression and reactivation of latent infections. Viral infections, cytomegalovirus, CMV, most common in solid organ transplant recipients. Epstein-Barr virus, EBV, associated with post-transplant lymphoproliferative disorder, PTLD. Herpes simplex virus, HSV, or varicella-zoster virus, VZV. BK virus, linked to nephropathy in kidney transplant recipients. Fungal infections, Aspergillus species, especially in lung transplant recipients. Pneumocystis jirovecii, causing pneumocystis pneumonia, PCP. Bacterial infections, opportunistic pathogens like Listeria monocytogenes, Nocardia species, or Mycobacterium tuberculosis. Number 3, late post-transplant infections, 6 months. Infections in this period are influenced by the degree of immunosuppression, community exposure, and the patient's overall condition. Viral infections, reactivation of herpes viruses, CMV, HSV, VZV, community-acquired respiratory viruses, influenza, RSV, COVID-19. Bacterial infections, community-acquired infections, e.g., pneumonia, UTIs. Chronic infections like Mycobacterium avium complex, MAC. Fungal infections, endemic fungi, e.g., Histoplasma capsulatum, Coccidioides immitis, Blastomyces dermatitis. Parasitic infections, toxoplasmosis, Strongyloides stercoralis reactivation. Key points: prophylaxis and monitoring. Transplant recipients often receive prophylactic antibiotics, antivirals, e.g. valganciclovir for CMV, and antifungals based on their risk profile. Individual variation. The specific risk depends on the type of organ transplanted, e.g., lung transplants have higher fungal infection risks, and the intensity of immunosuppression.